Welcome to the Healthcare Plus podcast, hosted by Quint Studer and Dan Collard. I'm Nicole Webb-Bodie, partner at Healthcare Plus Solutions Group. Thank you for joining us as we bring together leaders and changemakers from across the healthcare industry. In each high-impact segment, you'll hear about the latest challenges organizations are facing and learn how guests are rewiring solutions to drive real change. Plus, you'll walk away from each episode with practical tools, techniques, and best practices to implement in your own role and in your organization. For more information on your host or to listen to recent episodes of the podcast, please visit www.healthcareplussg.com/podcast. Now, here's your host, Quint Studer, who will introduce you to our next guest.
This is Quint Studer with Healthcare Plus Solutions Group podcast, and I'm excited. Not too long ago, I got the treat to go to Carlinville Area Hospital and Clinics, and I got with the invite of Brian Burnside, their CEO, and I was just absolutely astounded of what they're doing. And, when you read about small rural hospitals, every healthcare provider is being challenged right now. But certainly those in smaller communities and rural areas are certainly being challenged even more so. So when you find the bright light, when you see somebody that's sort of doing some things that might be helpful to others, my whole goal is to bring that type of information out to others, because the beauty about healthcare is people want to help others. They're not sitting here like, this is my little secret. I don't want anyone else to know it. So while we know healthcare has great purpose, I just read again in the paper not too long ago, small hospitals are closing and closing. So when you tell a little bit about your success, and you just got some new success with your employee engagement results, looking at your clinical quality. I mean, I've seen your dashboard. It's quite amazing. You're also pretty sophisticated in your strategic planning and where you're going. But when you think of the attributes, and Brian, you and I have known each other for a long time. You've had success everywhere you've been. For someone in a smaller rural setting, what are some of the attributes and actions that you find that you've been taking, and others have been taken, that you think really help, which has been really a real good, successful run by Carlinville Area Hospital and Clinics?
Oh, Quint, again, great. Thanks for the invite. Great conversation we're about to have. It's such an honor to be representing Carlinville Area Hospital and Clinics with you here today. We had a great visit when you were out here in Carlinville, and I can't wait to see you here again someday in the future. You're exactly right. Healthcare in the small and rural environment it's tough. It's a challenge. There's a number of factors that make it difficult to succeed in the small and rural environment. But what I have found, and what this organization has been so special with, is having a great vision for the future. And that vision didn't come from me, didn't come from the CEO, but it came from a great board, a great medical staff, and a great team of people here at the organization that really knew that we could be something special related to providing great care to our community. So one of the things that was pretty neat is this organization had a long history of being built on a very solid foundation, very stable, very much ready to launch. And when I came here 4 years ago, what we just talked about is how to generate some momentum, how across the organization we could get some things rolling. My dad's 89, and he always says, you can't steer a parked car. Well, we wanted to get that organization moving a little bit and trying to create some momentum. And that was really a big portion of the success that we've seen over the last couple of years. I think the other piece that has been crucial, Quint, is really having an eye towards the future, having an understanding of where you want to lead your organization towards. How does healthcare need to be delivered in your community 5-10 years from now, and even today? And I think establishing that vision early became a great rallying cry for all of us in the organization. But ultimately, one of the biggest things that I could say has been one of our success factors And I probably have just two more to share. One of them has simply been taking care of our team. Truly the healthcare workers, the nurses, the lab techs, um, just the whole team trying to make sure that we are making decisions through the lens of their eyes. And when we've done that, we've been making good decisions over and over and over, and that's helped our organization to achieve success. I think the last thing I would say, you mentioned our strategic plan. And one of the things that we have been really rigorous on is strategic acting in addition to our strategic planning. We had a strategic plan that we put together, and we put that together in late 21. It was for 22 through 25, 2025. It had 40 objectives on it. And so far, here we are in the middle of 24, and we've already achieved 36 of those 40 objectives. So strategic acting was a big part of our efforts here to make sure that we weren't just going to talk about what we needed to do, we were actually going to act and get it done.
I love that. When I got to Holy Cross Hospital years ago, one of the things I did is I said, we're getting rid of the planning department. People looked at me like, what? I said, right, we're going to change the name of it to the implementation department. We're short on planning, but we're short on implementation. So for our listeners, tell us a little bit about Carlinville. How many employees do you have, the medical staff, so our listeners can sort of get an idea of the size and the scope of your team.
Sure. Our organization is in Macoupin County, Illinois. Our town, Carlinville, is 5,000 people. Macoupin County is 45,000 people. So we serve the whole area. Our organization has about 280 employees, all in all. So it's relatively small. Board of 7 leaders, executive team of 7, and medical staff that has been focused on primary care development. That's been a big portion of our effort here, is developing our primary care strategy, but then supported by a cast of specialists, over 20 specialists. So our structure is relatively small, but we've been able to really achieve some big results with that. Over the last 4 years, our gross revenues have doubled in size as our primary care strategy has focused the individual patients to care that they could receive locally by our specialists. We believe that we've kind of developed a comprehensive rural health system. Now, Medicare calls us a critical access hospital, and that's the designation that we have from our payment mechanism. But we believe that here locally, we're offering almost every specialist that a community member would need. And they love the idea that they can receive that care, especially here right close to home. So that's been a big part of our story.
Yeah, when I saw, you sent me all their information before I presented there, it just was incredible growth. I mean, and let's face it, your population isn't, no town, you've almost doubled your revenue. And no, your population is not doubled, which means two things. Either you're keeping people from leaving, which is normally it's, how do we keep the people here? You don't want, and I know you still refer out for birth and some of those. So we don't want to keep people that shouldn't be kept, but how do we keep the people that we can provide quality care? So I think that certainly shows that you've had the success doing that. So I think everybody here would talk about how do we keep people in our community that we could. Do you have any tips for those that are listening, what you've done?
Well, one of the areas of focus is to just simply be the best hospital, the best healthcare organization that you can be. What we have really focused on, again, is our area of deep expertise is on primary care. That's been the center of our strategy, but then we've partnered with many other organizations to provide us the specialist care. And so really within our walls, sometimes a couple times a week, sometimes a month, sometimes several times a week, we have all the specialists that a community would need. And what that is really saying to folks is you can receive great care here also close to home. You don't have to travel to see that specialist. We're bringing them right here to you in Carlinville.
So let me ask you a question, because I think some of your listeners, and I've worked over the years with small hospitals, and they get a specialist for a while, and the specialist comes maybe every other Tuesday, and it works. And then one day the specialist says to the organization that they do their primary work for, gee, it's just not worth it. The drive there, they're not organized. I'm not seeing as many patients as they said. When I was in your place, specialists want to come to Carlinville. They want to work in Carlinville, because almost every small rural hospital in the country, Brian, is trying to do that strategy. Let's get some specialists, get them here so they don't have to leave. Some are more successful than others. How have you kept your specialists even growing it? Because they're leaving, usually I think Champaign-Urbana area or some place in that area, bigger city, to come to drive to your place, spend time there. They must find it's worthwhile. What have you done to sort of not only attracting is just a part of it, retention of specialists in rural communities is really difficult. What are some of the techniques that you have found have been helpful?
Well, truly, you're exactly right, Quint. Actually, we hear from many of our specialists often that we're their favorite place to come and practice, and in a lot of ways, they wish that their home practice was similar to ours here, because we just are providing extra special attention to them and to their patients. Our superpower and everyone's superpower as a small rural hospital is to provide that friendly, casual relationship, and we really make sure we do that well with our specialists. So I think that's one of the kind of folksy things that we do here, from a standpoint of retaining folks. But more importantly, with our partners, Springfield Clinic is one example. We made sure that they understand that we're not interested in a specialist today and someone else tomorrow. We wanted to make sure that we're developing the service line, so our community could rely on orthopedics or cardiology or any of those services that are being offered. So our relationships are deeper, more service line oriented. But then truly, we really want to be that best environment for our providers when they're here.
I know when I left your place, I drove through Springfield. How far is that from you?
It's about an hour and 15 minutes.
I bring that up because it's not like it's 10 minutes down the road. It reminds me of a story in Iowa Specialty Hospital. Steve Simon, the CEO, I was there years ago, and Steve introduced me to two orthopedic surgeons. And he said, these are two orthopedic surgeons. Their main primary clinic is about 45 minutes from here. And they come here so many times, a week to do surgery. And I was sort of, well, gee, why do they drive 45? They even were taking patients from the town that they practice medicine in and having them meet them at the Iowa Specialty Hospital. So I met with both the orthopedic surgeons, and I said, just out of curiosity, you drive 45 minutes. You even have your patients drive here 45 minutes. Why is it? He goes, because I'm talking to you right now because we're running ahead of schedule.
Right.
And, that was it. It was, these guys really maximize my time when I'm here, and I appreciate it.
No, I think there's that. We really are focused on their efficiency when they're with us, but also we're really not treating our specialists as visiting doctors. They're part of us. They're part of the Carlinville Area Hospital Comprehensive Rural Health System, and so I think that level of connection is helping us in the retention of those providers.
So the other thing you've done, which really was exciting for me, because, you go into organizations, particularly small places, are all fighting for survival. They're fighting for survival. And I think we all talk about collaboration. We all talk about it, and we mean it. We mean it. I saw it during COVID. You saw more collaboration, but then once COVID, I remember during COVID, all these CEOs talking to each other every week and organizing care. And I don't think it was kept up after this, because it just doesn't happen. So I don't know if you created it. You'll tell us the history, but when I was in your area, I got to not only speak to Carlinville, but I was so excited to speak to 3 other hospitals at the South Central Hospital Alliance. And I was there with some of the things that you guys collaborate on, from chief medical officer to leadership development. I just was blown away. First of all the CEOs are so great, and you can tell you all get along. It's not about competition. It's about collaboration. So for our people, this is really a success story. This isn't about talking about it. This is acting on it, as you said. Tell our listeners what the South Central Hospital Alliance is and how it works.
Oh, well, great. It's a wonderful organization. It was founded in 2019 with 4 fiercely independent hospitals. So our hospital, Pana Hospital, Jersey Community Hospital, and Hillsborough Health are 4 fiercely independent organizations. The idea there was that organization, South Central Hospital Alliance, needed some momentum as well. And we just began the idea of saying, how can we collaborate to maintain our independence? That was really our thought process. And so we just started looking at things that were simple. Nurse education, right? It's something that all 4 of us needed. And could we collaborate on that effort? Well, gosh, all of a sudden we found out we could have success, and our nurses are trained in some of the similar fashions. Boy, in our ER, wouldn't it make sense if we had the same defibrillators, right? Well, we had defibrillator purchase. Let's collaborate and do that together. Now, of course, we're all formed under the proper articles of incorporation, but the idea was, let's not try to hit grand slams, 9 times at bat, but let's really try to just do some things that could make a difference right away. So that's been the core of it. But more importantly, we hired a great chief medical officer, Dr. Lawson, and he is helping us to take that collaboration and make it more medical service line collaboration. At this point, there's a sharing of a gastroenterologist amongst the services. Also, some wound care and some other matters are being shared between the service lines. And I think that has really been some of the successes that we've had. But really, even more so than that, just here in the last few weeks, we recognized that all 4 of our hospitals were going to change out our CT scanners within 3 years of each other. Well, let's do that together and make sure that we can collaborate in that issue. Also, we're reaching out to the state of Illinois right now. There's some grant opportunities, and we believe that serving the larger population of our 8 counties, that we may be attractive to some of those grant opportunities, and we've been collaborating on those matters as well.
I love it when, again, I'm at that age where I'm telling stories all the time. Anyway, I remember when years ago we were putting critical pathways in. This was sort of the forerunner of electronic health record. And I remember going to the other hospital in town and saying, we're going to both have clinical pathways. Seeing we share some of the same physicians, why don't we get the same critical pathway company? And the person wouldn't do it. And the doctors, I got a huge win because I offered it, because the doctor felt, at least he's trying, but this is what makes so much sense of what you're doing. And I met the chief medical officers. And again, you could see in the training I was involved in, just the respect that all 4 CEOs have for what you're trying to do. And you're all in this together. These all make sense. Now, here's one that I thought was sort of tricky. You had me come in and I spent some time, and it was sort of exciting, because it was neat to hear that some of the nurse managers are already implementing some of what we finished at noon, and then by 3 they're implementing. But, we were talking about things like, how do you select talent? How do you onboard talent? And these were hospitals that, in a way, you sometimes overlap a little bit in some of those arenas. Yet you're saying to everybody, we all want to have great leadership in our 4 hospitals, even though it might rub a little bit. Tell us about how you brought the hospitals together for skill development and leadership training.
Well, yeah, we had just a wonderful opportunity. We use leadership development as another kind of basis for all of us across the South Central Hospital Alliance. And every year we get all of the department directors together in the same room. So all the radiologists, directors, all the laboratory directors, all the nursing directors, all together in the same room to hear a message. And so, what a great example of collaboration, Quint. We were able to have you come and speak to us, and we were able to get a stronger message because we worked together to do that type of leadership development. So it really is just special. Back to the story of people, healthcare is so dependent on the staff, and the staff is so dependent on the department leaders and their the skills and abilities. And we just can't invest enough in them. One of the major things that we did here was a project called HR recalibration. Tracy Coster helped lead that effort, and it was really designed to look at matters through the teammates' eyes and to really do what was necessary to help them advance their skills, become more competent and confident wherever we could. So, one byproduct of that was a clinical ladder system that Jessica Barkley, our chief nursing officer, put in place that was really designed to help nurses increase their bedside skill set in addition to kind of their managerial types of aspects. So just so many different angles that we have tried to do through the Alliance and also here locally to advance our team's talents.
Well, I would encourage people to go to our Healthcare Plus Solutions Group website and go to the care model study that we did with ANA and AONL. We presented an ACHE and magnet. And basically, it's exactly what you said. It basically to 3,100 nurses and asked them for retention, what's the most important thing for you to stay? And skill development and career development came up. So I think the whole skill development, the career ladder, it's right there where it needs to be right now. And 84% of the nurses said they were more likely to stay if somebody's having a conversation with them on skill development. And, that's why in my book, Rewiring Excellence, we talk about personal retention plans and career development.
Right.
And, in the old days, we said, well, gee, they'll leave then. Well, they're going to leave if you don't do it. So you have a much better chance if they do it. So now I'm going to pivot a little bit. We've hit some of your success as a hospital. I love the specialty. We love this South Central Hospital Alliance. And again, to the other three CEOs out there, and why don't you tell them our names and their organizations one more time for our listeners?
Sure. Trina Kastner at Pana Community Hospital, Mike Alexander at Hillsborough Health, and Beth King at Jersey Community Hospital.
Very neat to see all of you working together like that. And that is just so, and again, just really exciting. Well, I got a call from a CEO of a Chamber of Commerce of a town, and he said, Quint, help me. Our CEO of the local hospital was always very involved in the chamber, but we're just not getting that type of involvement anymore. Is there anything that you think we can do to get the CEO more involved in our hospital? And I was probably way too flippant, and I apologize for already now thinking I probably shouldn't have been so flippant. I said it might not happen. And now for our listeners, let me explain. This is a mid-sized city, probably, not small, not big, mid-size. The hospital is part of a large system. It seems to be that the CEO gets there and spends about 3 years there. So I would call out of all their hospitals, maybe not about average or a little smaller than average. They tend to spend about 3 years there, and then they exit. They either go to another hospital in the system. I got a call from a new person who just got their first CEO job, and they're part of that system, and now they're even moving to another state. And I said, it's just the nature of the beast. A lot of these are big healthcare systems now. And in the big cities, they actually still are quite involved because you could be the last stop on somebody's career. So in the big cities, if you read about some of the great work done in big cities, big CEOs, they're very involved in the community. It's But in the systems where somebody's leaving, and I said, when they get promoted, they're not going to get promoted because they created a better city. They're getting promoted so they had better results in the hospital. And you can't blame anyone for that. I think the average CO is 4.5 years now that they're in a hospital setting. And I don't have a problem with people staying short periods of time if they make it better. But what I was really impressed with Carlinville Area Hospital Clinics, and I'm sure almost every rural small hospital CO can relate to this, man, a big part of their job is community leadership. I mean, they're a big employer. You have 290 people. You're probably one of the largest employers in the county. You have a really important task, provide care for the community. Some of the training and leadership training you're doing, all the other small businesses can do that. So, and sometimes, you are locally owned, which maybe that's an advantage. But why don't you talk about some of the ways that you and the other CEOs that you've talked about the Southern Alliance, but for you, let's talk about Carlinville. Man, on short notice, you wrote a note to the chamber and said, hey, this guy, Quint Studer's come in. He wrote a book called Building a Vibrant Community. Do you want to do something? We had a great afternoon with it in there. And I'm not saying it because I was there, but man, they were engaged. And you could see that the hospital clinics were a central point for community development. So why don't you talk about some of the ways that you're involved in the community?
Well, I think it's really a whole hospital effort. And I'll just share a couple of different perspectives. I mean, number one, I grew up in a small town and watched my dad be involved in everything. And so, I think I just grew up knowing that was a part of what leaders did, was they were involved in things that mattered. But one of the things that we've tried to do here at the hospital is take our momentum, take our positive culture, and have that transcend our walls into the community. We feel that we want to help our community have the same momentum and the same types of successes that we're experiencing at our hospital. So I've had the opportunity to work with a number of different leaders here. One in particular is John Griffel with our local Chamber of Commerce, who are really focusing on trying to create that outstanding future for our community. John and the chamber, which I'm a member of, really are setting out a vision for how does this small town continue to thrive in a future way. So from our standpoint, from my standpoint, the first thing you can do as a healthcare leader is to run a great organization. I think that's the best help that you can give to your community, is to run a great, successful organization. But once you have that momentum and once you have established that positive culture, help spread that back out into the community and look for those same opportunities to create successes within the community. So we're doing with the chamber some of the same types of things, trying to broker collaborations, trying to set up a thought process about what does the future of our community look like? How do we attract businesses? All of those types of things are what we're trying to do at that level. And I think that probably a big part of it is something you taught me a long time ago: celebrate the successes. Right? In small towns, sometimes there's so many things that need to be addressed that we lose sight of some of the successes that people are having. And so we're trying to celebrate the wins as we go.
I think I might have told the story. I was in a small organization and, I just had access to other patient experience. It's, most of it you can get to go online. And I just mentioned to them, do you know your patient experience right now is better? And I named big national organizations that they knew of. And they looked at me and said, we are? And I said, yeah. No, I'm not. And see, I agree with you. I think it's a sense of great community pride to say, wow, we're lucky we have this here. We have this here. We have this here, because you're a very stable employer, and then you attract other people. And, I spend enough time in your place to know that everybody loves, I'm not saying everyone, but everybody I met certainly loves working there. And even the companies, because you do outsource a few things I met,
Sure.
And man, they love being part of Carlinville Area Hospital and Clinics. Plus, you got great clothes. I mean, you really set the trend with some of your clothes. So again, we hit all the great things, and people are going to get a hold of you. You have great patient experience, great employee engagement. This what you pulled off with specialists wanting to be there because they, again, I've been around long enough to know a big clinic like in Springfield will show up and they'll come for a couple months, then it's a little less, and then it's not at all. And you've actually expanded everything you've done. You talked a lot about the South Central Hospital Alliance, but I would encourage anyone to contact you because I think this is very duplicatable in other parts of the world. And some do it, but they don't do it to your extent. They sort of do it loosely. You've really coordinated, pulled together. The community involvement, the respect, again, I got follow-up from the president of your chamber, dropped me an email after I left and to talk about just about what you guys are doing and how happy he is to have you and all your leadership team, because you've really have a consistent leadership team. But I know just last week, reading I think it was a Wall Street Journal or something, it was a whole bunch of hospitals that were closing, and I think in Tennessee and things like that. And, all of a sudden somebody pulled the plug on the local community. They're trying to maybe get an ER to keep going or an urgent care. They're trying to attract somebody back because once you lose something, it's really, really hard to get it back. But, you're an optimistic guy. I think it probably comes from your dad. It's a little show me steak Missouri attitude here, but which is wonderful. My dad's a Missourian. So how about give people hope? Because you're an enthusiastic guy and you really drove hope into your community and optimism and enthusiasm. Why don't you tell the rest of the people why they should be hopeful about the future of small and rural healthcare?
Well, I that's a great question, Quinn. And I guess, the fact of the matter is, I believe all of us who are in leadership roles, we are shaping the future. And so we have a choice, either to, be down about the future or down about changes, or we can try to shape the future into what we know that it can be. And what I believe is that rural healthcare is instrumental in the overall continuum of care. There certainly is tremendous need for tertiary medical centers and all the tremendous advances in medicine. That's not what we have to do in rural in environments, but we have to be able to do our part, and we have to be able to do it very, very well, because people in our communities will go to where they can receive good care. And it's just a bonus to provide that good care right close to their home. So from my perspective, I think my team and I, when we see an obstacle, it's very rarely a brick wall. It's very rarely a concrete barrier. It's maybe a mountain to be climbed, or it's maybe a small hill to jump over. But truly, what we're seeing is anything that we are facing, let's just pull together and overcome it. And I think so many other organizations sometimes just have that moment of, well, we can't, or we shouldn't, or boy, we're just a small rural hospital. And what we've found is wherever we are trying to fill the bubble of what our capacity, meaning our capabilities, what our capabilities are, every time that we tried to advance that has worked out well in our environment. So I'm really optimistic for the future of rural healthcare. I think it is critical to the overall success of the entire healthcare industry. And I believe that there's great success to be had in the rural communities.
Well, yeah, I started on a 35-bed hospital, and it was a wonderful thing. There's no such thing as that's not my job. In a good culture, no matter how big you are, there's no such thing as that's not my job. I was crazy enough to drive from Florida up to your place, make a little ride out of it. And then when I left, I drove up into Wisconsin. And, I left your place so excited, so optimistic. I guess I called it replenished. Here we did replenishment exercises, and I got a lot of replenishment from being in your place. But man, you just hit a story about it. If you're a CEO, it's easy to get your emotions drained. And my first hospital CEO job, it was rough. We were losing some money. even when we're busy, because you're busy and you're still losing money. And I want to tell you, I was really down, and I was not being a good, optimistic president of a hospital. And at one of the meetings, I was really lucky. There was a fella on the team that was older than me. He's passed away now. I thought he was one of the best executives I ever saw, named Dick Fulford. And after I'd done, nobody challenged me, but obviously I was being more negative, pessimistic, and so on. He asked if he could see me out in the hall. This guy had guts, and he reported to me. But he was, again, probably 15, 20 years older than me, took me out in the hallway and said, "You got to stop it." He said, "You've got to be optimistic. You've got to bring energy in there. You're not bringing energy. You're taking energy away. And as the CEO and the president, you've got to be more optimistic." I went in and I changed.
Right.
So the beauty about I met your team is really comfortable holding up the mirror to each other and so on. But, you're a natural, maybe not, but every place you've been so successful. And Carlinville Area Hospital Clinics is very, very fortunate to have you. And I think our listeners are fortunate. They're fortunate too, because they're going to be able to contact you and get information. And I want to thank you because, you're one of those bright stars in this healthcare universe that just makes life better for everyone, including myself. So, Brian Burnside, thank you so much for being my friend, my buddy.
Thanks, Quint. Again, I appreciate all your mentorship over the years. And, I guess probably the last thing I would say is I appreciate the kind words, but truly it's a wonderful team effort here. I think that, the strength of any organization is with the team, and I appreciate the kind words. We have a lot of great things that we can do together, and look forward to continued friendship.
Yeah, and it was obvious your team feels that way. I mean, I never felt like this is Brian's deal or Brian's deal. I mean, you have a very unified team. We're all in this together. And I felt that way even with the Alliance too, the feeling. So thank you very much, Brian. I appreciate you being here, and have a great day. Thank you.
Thank you.
If you would like free resources and access to our latest books, articles, and industry insights, visit our website at healthcareplussg.com. We hope you'll join us next time as we continue our journey to make healthcare better for caregivers, patients, and communities.